My name's Clare, Claire Lawrence, and I was recruited as a clinical nurse specialist by Princess Alice Hospice in Esher to take part in the Needs Rounds project.
I'm Louise Duffy and I'm the manager of Abbeyfield Care Home in Ballyhoolish. We used the Needs Round for 12 months and we really wanted to share our learning so that you could perhaps start using the Needs Round in your care home. We're going to talk through today a few things that you need to be in place to be able to do the Needs Round and for them to work. And we would like to share some of our insights into them, including what they are, how they work, and how they can benefit both your staff and team and your residents.
So, a Needs Round is a discussion between care home staff and hospice palliative care expert. And the main aim is to try and improve palliative and end of life care planning for the residents in care homes. So the discussion can include a variety of things. It can focus on physical symptoms. It might be psychological issues. It might be social, spiritual needs. So it's everything really to do with the resident and how they might have a better end of life for things that they want. It's about a discussion of what might happen, recognizing when deterioration is occurring, and trying to put in place all the things that should be there for a good end of life.
The Needs Round can also include clinical work such as pain assessments, clinical assessments, family and multidisciplinary team meetings. The good thing about the Needs Round is that no one owns it. The main idea is that it's joint working between people from different organisations so that you can get the best end of life for the resident.
It's when there's everybody who is involved and knows that resident the best that you get the best quality discussions. Other services could be involved as well. So GPs could attend, community nursing could attend. And that might be appropriate. I think in lots of places it's slightly different. And the needs rounds are flexible enough to manage that. I think in a number of the rounds that I did, we had a whole variety of people from within the care home. So there were activity coordinators that attended, and in one of the rounds, we were discussing the particular kind of nutrition needs of a resident, and the chef decided they would like to come along as well. And I think that's the really important thing. It's everyone involved in providing care to that resident who could bring their ideas and listen to the discussion and improve the quality of care for that person. So the needs rounds were taking place during COVID, and I think it did have a huge impact on being able to access some of the care homes. So while they were in lockdown, I wasn't allowed in to conduct the needs rounds face to face, but they do work remotely as well. So we were able to use Teams or Zoom to continue the discussions, and there wasn't really any difference in the actions that we could take from them. It was just a different way around of doing it. I think another thing was staffing. So with staff sickness due to COVID or staff turnover as the kind of year went on, that I didn't always see the same staff at every needs round. But again, that didn't really matter. I think it was if the staff knew the resident that was being discussed and they were the right people to be there, that's absolutely fine. In some of the needs rounds, it was either one-to-one or a very small group. In others, it was larger. And again, the model works just as well both way round. So that was absolutely fine.
Interagency working is a huge thing for the Needs Round as well. Some care homes are lucky enough to have a fantastic relationship with their GPs, but others don't. Needs rounds can complement GP care without trying to replicate what the GPs are doing. It gives the home and the staff a chance to think of what the hospice staff can bring to the table, which is different. So they might have more specialised skills in symptom management and medicines. GPs do have knowledge of symptom management, but when you've got the hospice staff who are more trained in that specific area, sometimes they can think outside the box, and you can actually come up with something that's much more beneficial for the resident.
So I think before needs rounds take place, the main thing to do would be to have a meeting to discuss what the aims are. And there's a really useful checklist that can help guide that process as well. So how to choose a resident to bring for the discussion, what to talk about in regards to their needs, what you want to do in terms of action. So are you going to make referrals to different services? Are you going to put different things in place? So to kind of identify what you want to get out of the needs round. The other thing is, because they can also include time for discussion and education points, that you might want to bring a specific topic, and if there's time, to be able to talk about that. The other thing is to plan a date and time that you can do them. It's really important to try, if you can, to prioritize that date and time, so that everybody knows when it is, everybody can attend, and as we were mentioning earlier, that there's that engagement from management, that they don't necessarily need to attend all the rounds, but to be able to facilitate the staff who are looking after the residents to be able to come and take part in that discussion, to have that opportunity for education, and to take away from it what they can do to improve the quality of care that they're giving.
I think partnership working is a main part of the needs round. The partnership approach that we adopted was vital, to ensure that we developed good relationships with our staff and the staff at the hospice. Building trust and working in an equal way is very important. We're both experts in our own fields, but when you bring that together, and we certainly valued the expertise and the advice from the hospice, it was really important to be able to run the needs round successfully. The needs round is all about learning together, learning from each other, and the ultimate goal is to make that end of life care for the resident better. And the best way to do that is work collaboratively and in a non-judgmental way. I mean, we had a lot of staff who felt, well, I'm just a carer. You know, the hospice staff, they're trained, they've got their qualifications that I don't have. But it's sitting down together and talking, asking questions, because there are no stupid questions, and just realizing that we all know the part of the job we do, and the more we can talk and work together, then the better care there is for the resident. So the benefits of using the needs round, first and foremost, was clear value for the residents. We became a lot better at prioritising the needs of those that were at risk of unplanned dying, really honing in on anticipatory care planning, the processes. We became a lot better at managing the symptoms. There was a much better improvement in the confidence of the team, which enabled some of our residents to have a better death. Um, the other point from the staff was, as a manager, I can tell the staff they're doing a good job, I can praise them, but to have someone else who's specialised in that field come and say to them that they were doing a really good job really built their confidence, it boosted them. We've improved our communication and anticipatory care planning. We've got better knowledge, better links to specialist services. We also felt more confident in speaking to the families, especially at an earlier stage. Um, Before, it would tend to be sort of in the last weeks or days of a person's life, you then think, oh, what do they want? What have we to do? Whereas now we can try and have those conversations sooner. We all know nobody likes talking about end of life or death, but it's very important so that we can try and make it the best death someone could have. The needs round also helped the staff feel more confident in talking to the GPs. They felt better equipped to ask for medication, and they knew better how to describe the symptoms in a more detailed way to the GPs. So overall, it was really, really beneficial to the team and the residents.
I think for me, the main benefit has been a much better insight into to care homes and the complexity of the work that they do. We developed much stronger relationships with the care homes that were involved in the project, and I think that would be an important thing to replicate in all the areas. So, you're better able to respond to the needs that they have, to support them in discussions that are difficult, but ultimately to improve the end of life care for the residents that they're caring for.